do see that as a strong possibility, and when I hear about the um, prohibitions against DEI efforts, uh, I think a lot of people retreat to the fact that they use the acronym, because I would ask them, what is it you're against? Are you against diversity? Are you against equity? Are you against inclusion? Tell me what's wrong with any of those things. Um, and so individually, it's indefensible to go after any of those things truly in a civilized society. But people can go after the acronym. And, that's probably the most troubling thing in all of this, is that people that are engaged with the healthcare system on their face are in a vulnerable state, right? Just by virtue of being engaged in the healthcare system. Putting those additional pressures of us and them on people, not allowing explicit engagement to identify and remedy disparities, harms human beings. It harms individuals, and it's not simply sloganing. It's not simply political posturing. It really is impactful on human beings, and that's what I find sort of most disturbing about all of this, is that if there is science beyond and behind what they're talking about doing, I'm all for it. I'm an engineer by education initially, right? I believe in science. I believe in facts and numbers. I don't believe in hate as a factor, or discrimination as a factor in providing sort of basic needs or healthcare, which I believe is a human right. So, we will push back on those efforts, but I think some of it may take what many organizations are doing and just rebrand things, right? We will not shy away from our commitment to seeing that all of our members, all 550,000 members that we serve, have the same opportunity for quality health care. And if they live in a rural area, rural North Coast in Oregon, or if they live in downtown Portland, if they're an immigrant from Vietnam or Lagos, they have the same opportunity, and they should have the same right to quality health care. And if we identify disparities in that care based on something other than their healthcare status, then we will work to address it no matter what they call it. We are internally at CareOregon. We're having a number of conversations to prepare for inevitabilities, or even possibilities, just because it's the right thing to do. Right? Better to have the plans in place and not need them than to need them and not have them in place. And so we are actually consciously making our organization even more efficient. Right? We are identifying and prioritizing the work that we do, the programs that we have and that we support, so that we can quickly move on any reallocation of funds that we need to make, or changes in membership demographics or geography. So we're actively looking at that at the CareOregon level. At the state level, I think Oregon, by our very nature of being sort of a frontier state, is actively pushing back on a lot of those efforts. The governor has committed to supporting Oregonians, and fighting back when appropriate. The Attorney General is very active in engaging with other states' attorney generals and even the communities here, to say, how do we identify and analyze the actions coming out of Washington, to identify where there's a valid reason, where it makes sense and we should support wholeheartedly, and where we don't believe it's fair or equitable, frankly, the actions that they're trying to take, and we'll push back on those. So there has not been wholesale strategy being made at the state level saying, if this, then that, necessarily. But we have marched forward with saying, how do we build and support a program that's one of the most, inclusive and progressive in the nation, and seeing that people get coverage, with 95, 96% of Oregonians covered for health insurance. We're proud of that, right? The Healthier Oregon program, where folks who, even regardless of their immigration status, get health care we're proud of that. And so those are the kind of things that that we're looking to find ways to support, regardless of what comes out of DC. So it will get interesting depending on how far they push, and how far we have to push back. But it's not. We're trying not to make it completely adversarial, right? I mean, the federal government is a partner in this work. We've had amazing experiences with CMMI, with CMS, because in addition to Medicaid, we also have the state's largest dual eligible program for Medicaid and Medicare, right? So CMS is a direct partner with us there. We've got an arm of the company that does in-home primary care, palliative care, and hospice. There's a lot of work happening there. And so we need a partnership, a strong partnership with the federal government, but we can't and won't ever abandon our membership or our communities for political whim or for just scoring points. And so it is going to get much more dicey as they narrow in on the budget discussions and what makes the cut and what doesn't. Then we'll be able to more clearly articulate, the if-then statements that we have to be prepared for.